I'm Dr. Mary Ann Bowman from the American Stroke Association, and I want to talk today about cryptogenic stroke, a stroke where we don't know what caused it. It's an ischemic type of stroke, which means you haven't had enough blood flow to the brain. We have worked with our sponsor, Medtronic, to create a patient support tool. This gives information about stroke. How do you recognize a stroke? How do you avoid a stroke? What kinds of lifestyle changes you need to make? And how cryptogenic stroke is evaluated. It gives questions to ask your doctor. It is a wonderful tool because cryptogenic stroke is frustrating for doctors and for patients and for their families because you are prone to another stroke. And if we don't know why it happened, we don't know how to avoid that. There are some things we look for when we're evaluating for cryptogenic stroke. One of them is atrial fibrillation. This is an irregular heartbeat where the upper chambers kind of do this instead of squeezing normally, and that can create a clot. There's also patent foramen ovale. This is a hole in the heart that doesn't close in adulthood like it should and can cause clots. And finally, there's also people who are more prone to clotting. And if you're more prone to clotting, then you're more prone to having this stroke. So we want people to understand what causes a stroke, what is a cryptogenic stroke, and we want to raise awareness and make sure that there is consistent evaluation all across the country. So this is our main takeaway. We want to evaluate cryptogenic stroke. We want patients and healthcare providers to really know about this. For more information, go to strokeassociation.org/CS for cryptogenic stroke.